If you have a partner or loved one or family member or friend who has epilepsy and has just given birth to a new infant, you can be extremely helpful in managing their first weeks and months with the new baby. They're going to have a lot of stresses on them and they'll need a lot of support. One of the biggest challenges to a new parent who has epilepsy is making sure they get enough sleep. So partners and family members and support group members can be extremely helpful by taking shifts of taking care of the baby at night. Now, the American Academy of Pediatrics does recommend that the infants sleep in the same room as the parents or parent for the first year of life. So a lot of times, if it's possible, I recommend to my patients that they and their family members set up actually two sleeping spaces so that in the baby's room, there's somebody who can sleep with the baby and the person with epilepsy can rest in another room. Now, to keep tabs on both, sometimes there's baby monitors in both rooms if needed. But what we really want to preserve is that uninterrupted sleep at night for the new parent with epilepsy, because that's so important to preventing future seizures. A lot of this can be done by advanced planning, even just kind of thinking about it as shifts. If one family member is more of a night person and one is more of a morning person, just kind of thinking about who takes the night shift into the early morning and who takes the early morning shift. Thinking about how we can support, we as providers can think about how we can support the whole family. If the partner also needs a bit more flexible schedule at work, we can try to advocate for that, try to help. And then there's a lot of other things that you can do around the house. And even just thinking about how you set up your nursery and how you help each other and which chores are done by which parent or family member can be important. So for example, bath time is something that is often done either better with two supervising parents or two supervising family members, and that the person with epilepsy should feel comfortable asking for help or asking someone else to do that. Similarly, I personally don't recommend baby carriers for persons with epilepsy if they have convulsive seizures, because there's a risk that they could fall. And so making sure that other people can carry the baby strapped to them if needed, or that the baby can be carried in a stroller. Thinking about how you set up your nursery is also important, so that most of it is on one floor of the house, so that the parent with epilepsy doesn't have to be running up and down stairs with the baby. Things like this can just be kind of mindful and helpful for the whole family as a group.